$48 million in research grants are headed to Oklahoma for biomedical research. Jason Doyle reports that the money will go to further research in the fields of autoimmune disease and bioterrorism.
The Oklahoma Medical Research Foundation, or OMRF, will receive the money with $36 million dedicated to the treatment of autoimmune diseases. We're talking about conditions like multiple sclerosis, lupus, rheumatoid arthritis, type 1 diabetes, and psoriasis. Another $12 million will aid research on infectious disease caused by anthrax bacteria.
We're happy to talk today about two very large grants from the National Institutes of Health that will further that same mission. And that is making patients healthier, making our soldiers and other people in their military forces healthier and safer as they go out to protect us. And finally, for all of us as citizens, protecting us from bioterrorism.
OMRF is in rarefied air as a research institute when it comes to autoimmune disease.
And this is the third time in a row that OMRF has won that award. Only one other institution in America has done that. Only 10 have ever gotten one of these grants.
Congressman Tom Cole is a major supporter for biomedical research funding. He defended the National Institutes for Health when appropriating money to the Federal Research Agency became a political football. Now that political forces have come to an agreement that funding scientific and medical research is important to the well-being of Americans, these types of grants have become stable, giving researchers greater confidence that they'll be able to continue their work and make breakthrough discoveries.
I'm happy to tell you the last 4 years that's meant between $2 and $3 billion of additional funding every single year. Predictable, steady, ready.
And Cole believes that funding will continue in the next round of budgeting. He says that community support has been a vital part of OMRF's success in landing large grants from the NIH.
We couldn't do that if there weren't a lot of other people that made investments here, contributions here, if there weren't already the base of gifted scientists and researchers, if there wasn't the technical administrative support that they need to be. And we can appropriate all the money in the world, but there has to be an existing infrastructure, an existing commitment to use it.
Congresswoman Kendra Horn concurs.
And the example of OMRF is an important one of a public-private partnership that actually works, of the investment of people and individuals in our communities to say science is worth investing in.
She contends the grants provided by the NIH are a way for communities to work with the federal government to produce positive outcomes.
This funding from the NIH is a great example of how the government and private sector can work together. This government funding helps supplement the work that the donors across Oklahoma do.
OMRF used previous grants to bring autoimmune disease research home, giving Oklahomans access to groundbreaking treatments.
Over the past 5 years, we've provided opportunities to Oklahomans to be able to study things like when can we safely stop medication, and to provide the first ever prevention trial for rheumatoid arthritis.
The patients who have benefited from the research have come from all corners of the state.
And so this grant has provided direct financial support, I had to count this up last night, to over 100 different individuals in its last 3 renditions. And these people have spanned from being originally from Elgin and Lawton to Bartlesville, and from Watonga to Shawnee, and almost every place in between.
In addition to biomedical research, OMRF has been involved with bioterrorism research for nearly 2 decades.
So after the 2001 attacks, a group of Oklahoma scientists got together and asked how could we help address this issue. And we have been continuously funded as part of that effort ever since.
OMRF leaders say these major grant awards would not be possible without the continued support of Oklahomans, both patients and donors. Jason Doyle, the Oklahoma News Report.